We're live.
Good afternoon, and welcome to the COVID313 Community Coalition for Families and Youth. My name is Jametta Lilly, but I can't breathe. I can't breathe, and I can't grieve, and I cannot release the sense of anguish, outrage, pain, and frustration that I know Breonna Taylor's family feels, but all of us who have been a part of and continue to be a part of the revolution that we need in terms of not only addressing systemic racism and police brutality, but the revolution that we need in our very spirit. Whether we are Black, brown, white, we must come together to discover our power to effectively create change. I can't breathe. And I'll tell you why. As we move to that next slide, we all know, and we've all been impacted by the tragedy of yesterday. To say that a Black woman killed in her very home by her love who was defending her, that's with impunity, they're let off again. So we invite you to be just like the spirit of Fannie Lou Hamer, to say, I am sick and tired of being sick and tired, but we must continue the fight. And we will continue our fight with Sister Breonna Taylor and the hundreds and thousands of Black and brown bodies that have been crushed into the earth as the result of the ongoing racism that still perpetuates throughout this country and indeed the world. So we invite you, family, to feel the pain and know that we in this coalition feel it as well, but we will not succumb to what these decisions are made to do, to make us become angry and lose our control, to make us become angry and become frustrated, to make us angry so that we cannot act in a reasonable and fierce and awesome way. So we invite you. We invite you to come into this space with us as we connect to each other in this maddening pandemic, in this maddening time, and to be focused and to simply lift each other up and say, I can and will breathe no matter who tries to stop us in our struggle. So welcome. I'm Jametta Lilly, and I'm blessed to serve as the CEO of the Detroit Parent Network. I'm a proud member of this coalition, and I am the daughter and the granddaughter of folks who are just like the names that you've seen, and we are struggling to make sure that there's a better day today and a better day tomorrow. So we have, again, another very special program for you in which we are talking about voting, which is part of us claiming our power. We're talking about our health, our ability to be healthy in spite of COVID. We'll be talking about that we must be counted to make sure that resources come into our community through the census. We are talking and we want to hear from you. Please, family, don't forget, chat us through the Facebook Live, feel our pain, give us your ideas, your suggestions. Text us at 313-288-2082. We are with you in this audacious time to say we've had enough and we are going to create the change that we know our community and our babies need. And joining me in this every weekend, it's a joy to be part of this process, is co-host and moderator, Christine Bell. Christine, I can't breathe when I think of Breonna Taylor. Christine.
Me neither. And I think I'd like to encourage everyone to take a moment to make a commitment to themselves to honor her and decide what you're going to do to ensure that we get closer to this never happening again, and that we create a more justice system, because this is devastating. But she unfortunately is an example of so many, and I'm tired, and so I want to encourage everyone to do what you can to make sure this does not continue. I'm Christine Bell. I'm the mother of 3 children. I'm honored to serve as the executive director of UNI, and I'm a really proud member of this coalition. We are translating the town hall today to Spanish and ASL. So we want to give folks time to get on the right line and get comfortable. Cindy, can you please share the number for the Spanish translation?
Si necesitas traducción en español, por favor, hable al 313-626-7440, 313-626-7440. Hoy la señora Gloria Ruiz Mazón harán la traducción.
Thank you, Cindy. Katie, can you please share the instructions for ASL? Thank you, Katie. We want you to stay with us for the next 60 minutes to stay informed and powerful. And we're talking about today really how we ensure that our power is not taken away from us. So please stay with us. And this is also a time for you to ask experts your questions and share your thoughts and opinions with them. So to do so, you can write in the Facebook chat, or you can text your question or comments to 313-288-2082. Again, that number is 313-288-2082. We're going to have question and answer after each segment. If we can't answer your question today, we're committing to getting you the answers next week. And all the questions asked today will be posted with answers on onedetroitpbs.org, as well as their Facebook page. For our experts, please remember to speak slowly for our translators. They want to make sure that they're translating the important information you're sharing correctly. Also, turn off your cameras when you're not speaking to ensure our ASL interpreter can be seen, and mute yourself when you're not speaking. Terry Whitfield is our timekeeper. He will chat you your remaining time, so make sure that you're looking at your chat or have your chat open. If you go over time, Jametta or myself will come onto the screen and gently remind you to wrap up. It's really important that we have time for question and answers, so we want to make sure that we keep everybody moving. So I am really honored. Cindy has not been with us for the last couple of weeks, and so I'm honored to introduce Cindy Gamboa to start us off today. Cindy?
Thank you, Christine, and thank you, Jametta, for that amazing introduction to today's session. Breonna Taylor. Today, I honor her beautiful life and legacy, and I rebuke the injustices against her and so many of our African-American brothers and sisters. I'm sick and tired. I'm frustrated, I'm angered, and I'm ready for change. Let's all use our voice to exhibit our collective power in all the ways we can, whether that's by continuing to protest in our streets, by donating funds to local organizers and standing up against white supremacy. Whatever you do, just make sure you're doing that loud and proud. We're also asking you to don't forget, stand up for what you deserve. Please be counted during the census and use your vote as your voice against all of these injustices that we're witnessing. I know people are tired of these systems. And I know people say a vote isn't going to solve anything, but you know what? That's our first step. Things aren't going to magically change with this election, but we have to start there. It's our first step. We vote, then we organize. We make elected officials accountable to ensure that our communities get the respect and dignity that we all deserve. We are only 40 days from the election. And here in Michigan, you can start voting today. Early voting starts today. The stats tell us that people are more likely to vote if a family member or friend tell you to do so. So here we are, guys. Your friends at COVID313 Coalition are telling you, go vote. And tell your family and friends, urge them to vote like our lives depend on it, because it really, really does. It's time to unite our communities. And we got to continue to celebrate our rich diversity. We're in the middle of Hispanic Heritage Month. Last week, we celebrated the Independence Day of Guatemala, Honduras, El Salvador, Nicaragua, Costa Rica, and Mexico. And this whole month, we hope more people learn about how Latinos have contributed to this country as well, including the fight for justice alongside our African American brothers and sisters. Did you know that the fight to desegregate our schools in this country started with a Latino family? The case Mendez versus Westminster led to the end of segregation in public schools of California. And that paved the way for the federal Brown versus Board of Ed, which ended school segregation across the nation. Our histories are very much intertwined, and we must continue to fight for the equity together. I'm Cindy Gamboa, and I thank you for tuning in today. Now I'm going to pass it over to Jametta.
Thank you so much, Cindy. I don't even mind sharing that I really just want to cry. I really do. And there's been a lot of things that have gone on, but I know I'm not the only one. And so I'm smiling through the tears that I'm holding back. And I'm smiling because I know that consistently we are here with you to bring you voices to help us stay focused on the change that we need to rock, whether we do it in the boardroom, in the street, or at the dining room table where we organize our babies. So hold tight, be with us through this, and please participate in this process. So to begin, it's really so important. We're in the midst of this pandemic still. Is what else do we need to know and understand about keeping ourselves and our children healthy? And certainly that is a focus on immunizations. It's so critical right now, and help us better understand what that is and the implications, and perhaps maybe even some of the urban myths that are abound. We're so pleased to have come with us today is Japari Kazama. She is a nurse with our Detroit Health Department. Welcome, Japari.
Good morning, everybody. Thank you all for inviting me to this event. It's a pleasure to be here and be able to speak to you all about things that we need to consider regarding our health, especially as we are going through this pandemic. I will go through this presentation, and if you have any questions, I'll give a little bit of time to review those questions. All right, next slide, please. So I'm going to begin the presentation talking a little bit about my background and a personal story. I'm from Nigeria. I was born and raised in Nigeria. And I remember a couple years ago when I was little, there was a kick for polio vaccine. And I recall the nurses and healthcare providers going out into different communities and vaccinating children. So that was the first image of healthcare providers that has stayed with me all these years. So what happened was in 1996, Nelson Mandela, the great African leader, had began a campaign called the Kick Polio Out of Africa campaign. And the goal was to eradicate polio from the continent of Africa. At that time, 75,000 children were being paralyzed because of the polio virus. And what happened was many people were not getting the vaccination for polio. So when this campaign took place over the years, and in the last 24 years, we have seen that finally polio has been eradicated from the continent of Africa. Nigeria, my home country, was the last country to eradicate polio. And as of August 25th of this year, so literally a month ago, the African region was officially certified as wild polio free by the WHO, the World Health Organization. This is a promising situation that one day, who knows, the COVID pandemic might be out of our hairs and we won't have to deal with it one day. Hopefully it won't take 24 years, but one day we won't have to worry about COVID-19. Next slide, please. So we can't really talk about immunizations and vaccinations without talking about what they do and how they work. A simple definition provided by the CDC is that it is a product that stimulates a person's immune system to produce immunity to a specific disease. So I'm not going to get into the details of how all of this, how the body works with vaccines. However, they are administered via a needle injection, orally, or with a nasal spray. The different types of vaccines that are made are live attenuated vaccines, inactivated vaccines, toxoid vaccines, subunit vaccines, and conjugated vaccines. Next slide, please. So we'll talk about how immunity works. When a person or a body, let's talk about the body, when it gets infected with a disease or a germ, the body stimulates or has a response to these diseases that it has encountered. Next slide, please. After the infection and all the sickness has happened, the body's defense system actually remembers the disease and it creates what is called antibodies. Next slide. Yep, thank you. And basically what happens is that the next time the body encounters this exact disease or germ or virus, it is able to remember and provide the antibodies to fight the disease. Now with the vaccine, the body gets exposed to the germ, but not the actual germ itself, just a type of a germ. And then what happens is you don't fall sick, you don't experience the different problems or the different illnesses and symptoms that come with sickness, but you automatically develop those antibodies because the body has been exposed to that disease, that specific disease. And therefore, in that same way, the body achieves immunity as well. Next slide, thank you. Why are vaccines important? Number one, it is always better to prevent a disease than to treat it if it occurs. Think of all the costs involved in diseases and taking care of people. Think of the time spent, especially when it's something that could have been prevented. Second reason, next slide, please, is that many of the dangerous diseases that once plagued the earth are no longer present. Think of polio, for example, a disease that used to plague many children in Africa, actually around the world. However, it's not something that we have to be worried for. And this continues on, and our next generation will not have to be worried about these diseases. Next slide, please. And finally, prevention of the spread of disease from one person to another. We protect the people that cannot be protected. So if we all are vaccinated and we're immunized against the disease, we protect people that don't have that kind of immunity, and we create a herd immunity, a protection. Next slide, please. The influenza vaccine, also known as the flu shot. This year, more than any year before, it is very important to get this vaccine. The reason being is that we're currently dealing with COVID-19, and it would be really hard on the healthcare system, on a person's body, and just even harder with everything that we've been going through to have to deal with a flu pandemic. So it's very important because the CDC recommends that the annual flu vaccine is the first and best way to protect against influenza. Influenza spreads via droplets. So whenever someone is talking, coughs or sneezes, touches a surface, and the droplet touches a surface, a person can get that infection. It spreads from the first day that you might be, sick with it, or even before you start to have symptoms of it. And some people are high risk for complications from the flu. And these are people who are greater than 65 years old, children less than 5, pregnant women, and people with chronic diseases such as heart disease, diabetes, and lung diseases like asthma. Finally, I want to let you know that the flu vaccine does not cause the flu. It does not. However, you might have some symptoms such as a sore arm where the shot was given, and you might feel a little bit weak. But this is the body's form of creating that immunity. Serious problems from the flu vaccines are very, very rare. And this is why it's safe to administer and to get. The flu vaccine should be given to anyone above the age of 6 months. And it is to be given during the months of September and October, and all the way till next year, January, February, throughout the entire season. So it's never too late to get the flu shot. Next slide, please. And finally, with childhood immunizations. The CDC released in May of 2020 that there was a drop in the routine children vaccinations as a result of families staying at home. While families followed public health warning about going out, it's unfortunate because many routine vaccinations were missed. The CDC, as well as the American Academy of Pediatrics, recommends that every child continue to receive vaccination even during the pandemic. Therefore, it is critical to keep yourself and your children up to date with the vaccinations during the pandemic. It ensures that your child and our community are protected from preventable communicable diseases such as measles, mumps, and rubella. Staying up to date on vaccinations is one of the best things you can do to protect your child. The CDC also recommends that you can catch up if you have missed any vaccines, and you should speak to your healthcare provider about that. You can also visit the Detroit Health Department Immunization Clinic at 100 Mac. While the goal of the Detroit Immunization Clinic is to prevent vaccine-preventable diseases that affect people of all ages in Detroit, they work to make immunization services accessible and increase the number of Detroit children getting vaccinated on the right schedule. The clinic participates with Vaccines for Children, which helps provide vaccines to improve the chances of not getting those diseases. Our number is 313-876-4667. And the last slide, please. This is just a quote that I like to express to people. A major irony of public health is that the better it does its job, the more people tend to ignore it. Let's not ignore public health. Thank you, everyone.
And thank you, Japari, in particular sharing your personal story. And for so many people, they don't realize the impact that immunizations and vaccinations have literally banned diseases that were epidemic in the past. And if we're not careful, we can find ourselves going backwards, whether it's measles or others. So family, please pay attention. Please make sure that you're getting the flu shot and that you and your children are following the recommendations for immunizations. And so while we're talking about immunizations, we know that unfortunately, as we think about COVID, there are clear disparities in how this disease has impacted Black and Brown communities. And to help us to unbundle that a little bit, we're really pleased to have Dr. Felix Balbuena, who is the CEO of the Community Health and Social Services Center. CHAS has been a leader for decades in ensuring that there are healthy information and clinics available for our community. Dr. Balbuena, welcome.
Thank you so much, Shametta, and it's a pleasure to be with you again. I know I was here, I believe, 2 weeks ago, and I think this forum is extremely important in getting information out to the community. And so I'm going to just take a few brief minutes to talk a little bit about disparities, what they mean and how they impact our communities. So health and healthcare disparities refer to differences in health and healthcare between groups that are closely linked with social, economic, and or environmental disadvantage. Disparities occur across many dimensions, including race and ethnicity, socioeconomic status, age, location, gender, disability status, and sexual orientation. Why are these disparities important? Why do they matter? Well, they not only affect, not only the groups that are affected by these disparities are in question, but this also limits the overall gains that we get in the quality of care and health for the broader population and result in unnecessary costs. So in 2016, about 39% of the population in the United States were of color. Statistics show that by 2050, people of color will account for over half of the population in the United States. The current status of disparities. So we took a significant leap forward with the Affordable Care Act. That allowed a significant number of individuals to attain coverage, healthcare insurance coverage. But some groups remain at higher risk of being uninsured, lacking access to care, because it's not just the coverage, but actually being able to access the care, and then experiencing worse health outcomes. As examples, in 2018, Hispanics were 2.5 times more likely to be uninsured than whites. And individuals with income below poverty are 4 times as likely to lack coverage as those with incomes at 400% of the federal poverty level or above. So the Affordable Care Act put provisions not just to allow access to insurance, but access to care. And the Affordable Care Act leaned heavily on community health centers. Community health centers across the country are approximately 1,300 in number with over 12,000 delivery sites. So CHAS Center only has 1 site currently. Many health centers across the country have multiple sites based on the communities that they serve. And 4 key points in community health centers that helps us mitigate these disparities are: 1, we accept anybody that comes through our doors. So whether you're insured, uninsured, because we receive support from the federal government, we cannot turn anybody away based on their insurance status or their ability to pay. Second, we provide a very comprehensive set of services. So a lot of people still call CHAS Clinic in our 50th year, and we're much more than a clinic. It's really CHAS Center. And as a physician, I'm a family doctor. It's sometimes a little depressing for me, but on my best days in the exam room, because I still see patients, I can only impact the overall health and wellness of that individual in about 20%. The other 80% are those social drivers or social determinants of health that, by providing a comprehensive set of services, community health centers, along with all the community partners, are working to mitigate, to get as close as we can to 100% of dealing with the health and wellness of the communities that we serve. A third point for community health centers is that we're located in high need areas, so urban areas and rural areas primarily. And I think the most important part of community health centers, the fourth important point, is that the board of directors of community health centers must be 51% users of the center. So they have to be patients of the center. And the federal government, in doing this, is working to try and get the voice of the communities that we serve, helping to make the decisions of the services that are provided. the hours that we provide them in, the way that we provide the services. Is there mobile services? You know, are we doing things in community spaces, not just in the health center? So community health centers have been leaned on significantly to help mitigate these disparities or help address these disparities in health and healthcare because of the need for access, as well as the need to continue to improve quality in healthcare across the country. Community health centers are now serving over 29 million individuals across the country. The CHAS Center last year in 2019 served almost 11,500 we call individuals, or unduplicated users is the terminology that we use. And it's from birth to the geriatric population. We have newborns, we have patients over 100 years old, everything in between, including pregnant women. So all of the services that we're providing at the center and at centers across the country, like CHAS, that involve not just medical care, but dental and pharmacy and behavioral health and nutrition and exercise, the WIC program, are all working collaboratively and together to improve the quality of life of the communities that we serve. We have a long way to go. There is a significant amount of challenge, especially in today's environment, with the Affordable Care Act. So the Affordable Care Act is not perfect, but has helped a significant number of individuals access insurance, access providers, and quality care. But it's hanging in the balance currently, and we're working hard to advocate to be able to keep the Affordable Care Act, improve it, and be able to provide healthcare insurance to more individuals, access to providers for those individuals, and most importantly, deliver the quality, high quality of care that is key to having our community members be active members and productive members of society, whether it's at work, school, or other endeavors. So disparities, especially in healthcare, is a subject that has been studied and researched for many years. We all know that they exist, and we are working tirelessly every day at the CHAS Center to help our community members to be the best, be in the best health, so they can be their best selves at home and in the community.
Thank you, Dr. Valbuena, and thank you for lifting up that health is comprehensive. It's both behavioral health, it's nutrition, because you know, the last I looked, our head and our body are connected. So it's so wonderful that CHAS, as a federally qualified health clinic, everyone, family, it doesn't matter if you currently don't have insurance and you can get it, is that you need to be able to connect with organizations like CHAS. And he's reminding us that all the other factors that sometimes keep us from going to the doctor, we have to get focused on addressing those. And community focus is so very important with that. So at this point, I think it's important. I want to pause for a moment. Christine, do we have any questions or comments that have come in from the chat?
We do. We've got some questions about the flu shot and where to get vaccines. So the first question is, when should we get the flu shot?
So there are individuals that would say that to get the full coverage for the entire season, that mid-October to the end of October is the ideal time. I think especially this year because of COVID, we are working tirelessly to get as many individuals vaccinated as promptly as we can. We now have our, at CHAS Center, we now have our supply of flu vaccines, and we're working together with the city, we're working together with the state on initiatives to try and get as many people vaccinated as we can. Last year, I would say the overall vaccination in the state was close to 40%. In Detroit, I think it was maybe half that. And the goal is, because of the surge of flu in the winter months, fall and winter months, we want to try and alleviate the stress to the hospitals in dealing with individuals that need to be hospitalized for the flu by getting everybody vaccinated. I've received my flu vaccine. I don't know if you've seen it on our social media. We actually got pictures of my chief medical officer and I getting our vaccines, and we're promoting it at every chance that we get. We will be doing some dedicated flu vaccine sessions. So we ask that you look out for those on social media. But most importantly, when you go to your doctor, that should be the first question out of your mouth is, can I get my flu shot today? Because we need to get as many people covered. And the recommendation is from 6 months of age on. So it's just about everybody in the community that we're working to get immunized.
Great. How long does the flu shot protect us?
So that goes to that initial question. So we know that somewhere between September and March is generally the flu season. And so the flu vaccine to cover us all the way to the end of March, ideally is mid-October to end of October to get it. But a few weeks ahead of time, it takes about, once you get it, it takes about 2 weeks for your body to create the defenses against those 4 influenza viruses that are in the vaccine that we get. And so this year we're saying that the earliest you can get it, the better. And the coverage should get you almost, if not all the way to the end of the flu season.
Great. Thank you. And I know that we're at time, but I'm going to ask one more question. If someone had COVID, should they get the flu shot?
Most definitely. Most definitely.
Okay.
There is no reason not to get the flu vaccine, even if you've had COVID.
Okay. Thank you so much. We'll make sure that we get the information about where you can get vaccines on Detroit Public Television's website. But so that was one of the other questions, but thank you so much. And Jametta?
Yes. And thank you again, to both of our speakers around our health and our well-being. But while we're talking about our health and well-being and knowing how important it is, as we think about education, which is fundamental, and what we need to do as a community, we're so pleased to have back with us is Pastor Larry Simmons to talk about the Count Me In movement and what we need to make sure that we're doing to support it. Reverend Larry.
Hello, good afternoon, everyone. It is great to see you again. I am here as a part today of the Every School Day Counts Detroit Coalition. The Every School Day Counts Coalition is a coalition of community organizations growing out of the community's recognition that attendance is the prerequisite for successful education. Our goal is to reduce chronic absence to 15% by 2027, making this the major city with the lowest chronic absence rate in the United States. Our model integrates 5 pillars of work, which you see on the left side of your screen: research, advocacy, communication, wraparound supports, and professional development. These 5 pillars work together to advance the vision that school attendance is best when all the partners work in coordination to address the barriers to attendance and to create the school-going culture. Next slide, please. So when we say school-going culture, what exactly are we talking about? A school-going culture is a community in which all of the institutions, including individuals, family, business, faith, and philanthropic, and should also say government, do what we can to make things go smoothly and successfully. In this case, that students learn and grow into healthy, well-educated individuals. Next slide. A recent report says as many as 20% of students are not engaged in schools. And so you're going to hear me talk, if you're any place where I am, you're going to hear me talk about 3 kinds of power: personal power, collective action, and public policy. Too often we get caught up in one of these or the other. The truth is, it takes all of that to create the culture so that 1/5, 1 out of every 5 of our students is not missing from school. And so that's what the Count Me In movement is seeking to do, is to connect all of our children to a school. Next slide, please. The tragedy is this problem is not new. In fact, it's been going on for some time. So what I'm asking is that you pay close attention to the next presenter, as she's going to give us some data and background about this situation. Next slide. Here to help us with that data is none other than Dr. Sarah Winchell-Lindhoff, a PhD at Wayne State University and Assistant Professor of Educational Leadership. And at this point, we're going to go to Sarah. Hi, Sarah.
Hi, thank you, Rev. I'm happy to be here, and thank you to all of you who are joining us. And I just got my flu shot at Wayne State. It's offering free flu shots to any faculty or students. So if you're affiliated, go get your flu shot. I'm going to share my screen if I can, and just want to reiterate what Rev started talking about. So chronic absenteeism, we define it as missing 10% or more school days. A lot of research has found that chronic absence is associated with increased risk of dropout. So students who are missing 10% or more of the school year are much more likely to drop out of school. They're more likely to have lower achievement and lower socio-emotional development. And we know that long before COVID, Detroit had the highest rate of chronic absence of any large US urban district. So around in 2015, when there was the last national study, around 50% of our students were chronically absent, and nearly a third were missing more than 20% of days a year. So this is just a chart showing where Detroit is compared to the rest of the country, and we're far ahead of them. So I wanted to put this in context and just say that Detroit has unique structural conditions that make it more difficult for students to get to school physically. But we also think that these conditions may also impact students' ability to get to school in the virtual environment. So things like more chronic illness related to asthma, more crime, higher unemployment, or work schedules that don't coincide with school schedules. So these things are really relevant in the physical school environment, but also maybe contributing to engagement in the virtual school world that many of us are living in right now. So I wanted to mention how Every School Day Counts and our coalition are thinking about absenteeism, and how it's related, as Rev was saying, to both individual power and community power and responsibility, and recognize that students who get to school every day, they're getting to school because of both their individual power and their motivation and their resources, but also their community power, their community supports to getting them to school and getting them engaged, as well as the policies that help facilitate that. And that's still true today in COVID, and it's probably even, kind of more emphasized now in our current context. So given that Detroit has had super high rates of chronic absence in the past, we wanted to look at what is the potential impact of COVID on especially those students who are missing so much school. We interviewed 29 high school students this spring who were going through virtual learning for the first time, and we found considerable variation in their experiences, with many of them not participating at all in virtual learning, and some of them participating very inconsistently. So we found 28% of students weren't logging on at all, and 14% when they did log on, it was really inconsistent. And some of the issues they brought up to us related to why they weren't engaging had to do with poor communication from their schools, not really knowing how to do it, not having the appropriate technology, feeling like even when they logged on, they weren't getting the engagement that they needed from their teachers or from other students. Sometimes they talked about logging on and having only a couple of other students log on at the same time, and that felt really demoralizing to them and made them not want to participate. So I just wanted to flag these themes that we heard from the spring that I think are likely to still be relevant in the fall as we move into virtual learning, and that parents can be aware of and educators should be definitely proactively thinking about as they craft their virtual learning spaces. So, and finally, just wanted to share that there's a lot of variation in what students are getting at the school level. So there are some schools that seem to be really good at contacting their students, communicating well with them, and getting them to participate in virtual learning, whereas others, we had more variation or more students who were just really disengaged. And then students who were missing a lot of school before the pandemic were much more likely to not be engaged in virtual learning during the pandemic. So thinking about how do we make sure that we're being proactive in identifying those students who maybe were disengaged from school before the pandemic and are much more likely to drop out of school. We're really monitoring those numbers and trying to help the school districts ID those kids, contact those students, and make sure they're feeling supported as we move through this pandemic. So I'm going to stop there. I'm happy to take any questions or share any more details about our research.
Larry, you're on mute.
We still can't hear you, Larry.
We do see you smiling. We just can't hear you. Okay, so perhaps we have a little bit of a technical fluke. So what we'll do is Larry, as we're hopefully getting you back on for voice for your audio, I'll pause just for a minute and see if we have any questions in our chat, because it's so important, family, that we understand that our children are being held back because we must begin to focus on getting our children in school so in fact they can learn and move forward. Christine, do we have any questions so far?
Sarah or Dr. Lindhoff, could you, as we go forward into the school year, this new school year, which is a brand new adventure for all of us, is there, how might we encourage folks to connect with their schools based on what your research showed, and knowing that usually if friends talk to friends and family talk to family, that has the most impact. But what are some of your suggestions?
Yeah, I mean, I would say if you're having issues with, especially with technology or logging on, the best person to contact is just directly to your school, to your teacher. If you're not, I know teachers are really overwhelmed right now, and many of them who are teaching online have very large class sizes. So if you're not able to get a quick response from your teacher, I really encourage folks to kind of quickly contact their administrators, their assistant principals or principals to get things resolved. And make sure you're communicating any concerns, because I know the district just, all the school districts are trying to, address concerns as they arise, and this is new for everyone.
One of the questions is, so Larry, Dr. Larry, can you give it a whirl, your sound? No. So I've got two more questions that I can, that while Larry continues to try to work on his audio. Larry, why don't you try calling in on your phone? Okay, so somebody had asked if we could get the slides that you just shared translated. We'll get them translated so that we can share with our parents. And then one of the questions was, and I can answer this, and Sarah, Dr. Lindhoff, if you want to chime in, you can. But the question is, what counts as chronic absenteeism? That is anytime you are missing instruction for any reason at all. So suspension, expulsion, going to the doctor, whether it's excused or unexcused, anytime you miss instruction is counted towards chronic absence. And then chronic absence is when you've missed more, here's my coworker, more than more than 10% of a school year. Now this year it's a little different. And so Sarah, if you want to take it away, and I've got to help my Quentin, something must be wrong with his log on. So I have to go help him. So take it away.
Hey, Quentin.
Can you say
How
hi
you
to
doing?
Okay, there we go. Larry's back. Sarah's, Dr. Lindhoff, go ahead.
Okay, I'm back just in time for us to say goodbye. So, Molly, if you could put my deck up, I want to put the numbers up that people can call if they want to get someone counted in. You can contact the charters. Go down to the slide that says that's the schools. You can reach them here. Parents can contact MAPSA for charters at 844-642-453 and say, count me in. For Detroit Public Schools Community District, you can call 313-240-4377. And last but not least, if you are uncomfortable for whatever reason with calling either of them, you can call the Student Advocacy Hotline at 734-482-0489. And I would just close by saying people are 23% more likely to vote if they are asked by a friend. And I think that same applies to school. You are part of the solution. Please join us and call your neighbors and your relatives and say, count me in. Thank you so much. God bless you. God keep you. Breonna Taylor, say her name.
Thank you, Reverend Larry. And so while we talk about counting and making sure that our power and our numbers are counted, it's really important for us to realize that we're almost at the end of our opportunity for the Detroit Census, or the census in general. And so to help us think about that and how we're going to have this last push on our campaign is Victoria Kavari is the executive director of the Detroit 2020 Census campaign with the city of Detroit. Victoria, welcome back.
Thank you. So just to give a brief update, Detroit is at about 50.3%. And again, that number includes all of the vacant addresses, bad addresses, vacant lots, etc. When the census ends, they'll take out all the vacant addresses and just calculate the response rate based on occupied housing units. So we know that that 50.3% will go up. We just don't know by how much. So that's one thing. In these last few days, so today, the court is supposed to issue a ruling on whether to extend the census to October 31st. That was the deadline in place right after COVID hit. They extended to October 31st. And then about a month or so ago, the Trump administration said that they wanted it to be cut shorter, and they put it back to September 30th. So right now, it's September 30th, but after the court's decision today, it may be October 31st. What that means is we get some more time, but mostly it gives the Census Bureau more time to finish their door knocking operation and to process their data. So with us, we're trying to spend all of our energy down, all of our money down, as if the census were to end September 30th, because that's the only deadline right now that we have. So we have a bunch of events in the next 7 days, in the next 6 days, actually. We're at three major food distribution sites, one today, 2 tomorrow. We're going to be at Eastern Market on Saturday morning, as well as a bunch of grocery stores where we've been giving out $5 and $10 coupons for off your groceries. So we're at places like Prince Valley Foods on Michigan Avenue, and E&L Supermercado on West Verner, Grand Price Market on Grand River, a bunch of them. So, so we'll be doing that on Saturday. On Sunday, we'll be at a couple of different churches, Holy Redeemer Church on the southwest side. And on Tuesday, we're planning a large event at Fellowship Chapel, where we're actually going to give $25 gift cards toward groceries anywhere. And if you fill out the census on site. So we're going to be advertising that in the early next week on Monday and Tuesday. And we hope to at least have 500 people show up there and give them $25 gift cards toward groceries. So those are the kinds of events we're trying to sort of put it all out there on the floor, leave it all out there on the floor, as they say in basketball, through September 30th, which is Wednesday. And if the census is extended to the 31st, we'll probably do a couple of other major events. We'll probably extend our canvassing, which is now going on. We have our third pass of canvassing. We've already knocked on over 250,000 doors in the last 2 months. And in this past 2 weeks through next week, we'll have knocked on an additional 100,000 doors. So those are continuing. All I would ask the partners on the phone, if you have any event going on where you're going to have any sort of touch with the public, please incorporate a census component to it. Get people to go on the website, my2020census.gov, or call the toll-free number and fill it out over the phone. And that's 844-330-2020. The other big message is that you can get out through social media or wherever is encouraging people to open their door to the census workers who've been knocking on doors, to cooperate with them, to share information with them. The census workers are required to collect this information, and they're required to get what they call proxy information. So if they ask you if you know about the vacant house next door, if anybody lives there or how many people do, they are required by law to ask those questions, and people are required by law to share that information. This census happens once every 10 years. So we need folks to see the bigger picture than this fear folks have about their information. Census information is the most protected information in all of government. Personal data is not revealed for 72 years. Somehow we have to get people to understand that if people in their neighborhood aren't counted and the population in that neighborhood doesn't reflect the folks that actually live there, the population is what decisions are based on, whether to encourage redevelopment or to spend redevelopment money in a particular neighborhood. That's driven by how populated the neighborhood is, as well as decisions about political representation. Folks who say, well, that money ain't coming to my neighborhood, part of it is this kind of crazy logic that we're not going to count ourselves because we're not getting enough money, but we're not going to get enough money if we don't count ourselves. So somehow everybody on the call needs to try to get these messages out to folks that we are running out. It's once every 10 years we get a shot at this, and millions of dollars are at stake. If you want your neighborhood to count, we got to count your neighborhood. So open your door to the Census Bureau, share information about what's going on in your block. So those are the key messages that we want to press on. over the next, at least the next week, and hopefully if they extend the census over the next month. I'll turn it back over to Jametta. Thank you.
Vicki, thank you. And thank you for emphasizing the critical nature of us making sure that we are counted, because if we're not counted, we are giving away the money that we need for our communities to thrive. And when we think about thriving, we know this whole discussion today is about capturing our power and what we are due as citizens in this nation. And to help us be aware of what is our power relevant to voting, we are just delighted to have today Brother Hester Wheeler, who is now the Assistant Secretary of State for the state of Michigan. Hester, welcome, and help us understand in this crazy time, what is it the state of Michigan is doing to assure that everyone's vote is counted?
Jametta Lilly, thank you so very much for having me. I'm happy to be here. And as Vicki Kobari just highlighted, she says, don't ever make another presentation unless you highlight my 2020census.gov or 844-330-2020. That is so very important. But I am excited, Jametta, as it relates to voting. We've got so much at stake. So much at stake. And I am pleased to just be able to share with you some of Michigan's new voting rights and reasons we should get involved. And the fact is, we don't have power if we don't use it. So special thank you to you for inviting me, and Molly Sweeney and Brother Marty Fishoff. I'm happy to be here. Michigan does have new voting rights. No excuse absentee voting is a game changer. Same-day voter registration is in fact a game changer. Automatic voter registration is a game changer. In this COVID-19 environment, we've got some extra work to do to educate voters on the benefits of voting by mail, voting from the comfort of their own home. You don't necessarily have to go to the poll. You can if you choose, but you don't need to. In fact, 2.5 million voters participated in the process on Tuesday, August 4. 1.6 of those million voted by mail. That provided a tremendous amount of relief at the poll. If you're Black or brown, it's a good, and particularly if you're Black or brown and you're over age 50, it's a good chance that you live with a compromised immune system. So we're encouraging people to take advantage of these new voting rights. It's almost a moment of convergence. I would be remiss if I didn't acknowledge how significant this moment is for a lot of reasons. Just like COVID-19 is in fact a pandemic and we've declared a state of emergency, we also know that poverty is at pandemic levels and we need that same state of emergency. But racism and rogue policing is in fact a pandemic and we must declare a state of emergency. What happened yesterday in this country is unacceptable. Nobody should be expected to live beneath their privilege. Voting is the great equalizer. Voting is your power. Tuesday, November 3 is the one day of the year where you know everybody is equal. You don't have power if you don't use it. So we encourage people to take advantage of Michigan's new voting rights and get to the poll. We've taken a look around the country at various best practices. So you're hearing more and more conversations about ballot drop boxes. You're hearing more and more conversations about ballot tracking technology. And we're encouraging all of you, develop a relationship with your local clerk. The clerk is queen or the clerk is king. They need every bit of help. In the city of Detroit, in fact, Detroit needs at least 6,000 poll workers, at least 6,000. And I happen to know that the compensation is anywhere from $250 to $750 for each day, plus an additional $100 in hazard pay, depending on which position you make application for. But COVID-19 has reset the landscape. The average poll worker, Clerk Winfrey and I have been on several calls together, as you might imagine. And Clerk Winfrey highlighted that the average poll worker in Detroit is age 65. We were on several other conference calls or Zoom meetings from around the state, and a small community like Sturgis, the average worker is 75. COVID-19 says the paradigm is different. We need 20-somethings and 30-somethings and 40-somethings to get in the game and become election season workers. And if you notice, I very deliberately refer to this election as an election season because we can't promise you that we will absolutely know the election results by 10 p.m. news or 11 p.m. news based on the increase we anticipate in absentee ballots. If you don't hear anything else I say, I want you to take advantage of our website, michigan.gov/vote. We've been very deliberate, Jametta, to make sure that that website is user-friendly. You can go to our website. It will tell you exactly where your polling place is. It will tell you exactly if the closest drop box. Today is the statutory deadline for ballots to start on their way to absentee voters. In fact, I'm pleased to announce that I received my absentee ballot yesterday. In fact, I have it sitting right here next to where I am. Detroit is going to send out way over 100,000 absentee ballots. We just want people to take advantage of it. But if you go to our website, not only will it tell you your polling place, it will tell you your the status of your absentee ballot. It will tell you if or not you've made application. If you sign up for ballot tracking, that's another tremendous resource that you can take advantage of. Ballot tracking, just like the relationship you have with the airline, ballot tracking will let you know if or not your ballot has been mailed to you. It will let you know the day that your ballot has been received. It will also let you know if or not your ballot has been processed. So there's some new technologies, there's some new opportunities to get engaged. And I guess the two more things I'd like to share with you, just FYI. You don't have power if you don't use it. Jocelyn Benson and I, upon arrival, January of 2019, we said, let's take a look at the landscape. What are things that we can impact? We looked over at the Michigan Department of Corrections. We saw where some 9,000 residents return home every year. But they typically come home, they don't have a driver's license or a state identification. We said we can do something about that. So we started meeting right away. Today, I'm pleased to announce that everybody that comes home from a Michigan prison will automatically have either a driver's license, state identification card, and or a voter registration card. That is especially significant because we need to remind our various constituents that your right to vote in Michigan is automatically restored if you serve time in any jail or prison across this state. As long as you're not behind bars on election day, your right to vote is automatically restored. We also started another initiative called Voting Matters. We looked at the 100 low-performing precincts across the state, and we've been in and out of those various communities listening and trying to figure out why people won't vote. And I heard Vicky Kovari say a lot of the exact same things. Very often people don't think their vote counts. They don't think civic participation matters in their lives, when in fact it does. But we also know that there's a relationship between the number of times you touch people and the likelihood they participate. So you got to keep pushing. You've got to keep pushing. We had 3 elections so far in this state. We had March 10, the presidential primary. We had May 5. We had several smaller communities that had school board or bond issues on the ballot. And we had August 4. Each of those elections have informed us in a way where we know what we can anticipate on November 3. One of the things that is most significant is the fact that over 18,000 people took advantage of one of Michigan's new voting rights, which is same-day voter registration. Of that 18,000 plus, guess what? Over 50% were aged 30 or younger. Why is that significant? Because hundreds of those young people were ages 18 and 19. So that tells us that young people do want to participate. We've got some extra responsibility to stay on them, keep pushing, keep pushing. We've identified 250,000, 275,000 be exact, young people in Southeast Michigan that are already registered, but only participate at a rate of some 12 to 15%. So if you keep pushing, young people will participate. And if you know, like I know, that is in fact our secret weapon. So Jametta, thank you for having me. I think it's important work that you do. COVID313, I love these kinds of initiatives. And I think you know that I believe the very best way to predict the future is to create it. And when you participate in this process, you are in fact creating, look at you, got your absentee ballot. I don't think we should ever apologize for being committed to self-determination. I don't believe that where we live should determine if we live or die or have access to opportunities. And when people ask us, how long do we fight? There's only one answer. We fight until we win. Thank you for having me.
Wonderful, thank you. We're in a 1,000-year war, but we intend to win. So the folks on the other side, do what you're gonna do, because we're gonna do what we need to do.
We're staying the fight.
And
Thank you.
speaking of that, do we have some questions, Christine, from our audience?
Pastor, that was great. Thank you so much.
Christine, you're always at it. Keep it up.
Yeah, you're inspiring us and all of us. And so, you know, Rev Larry usually the one gets us going, and now you've added to it. Thank you.
You have. Thank you.
Thank you.
I want to ask for an offering right now.
Go ahead, Reverend Doctor. Uh-oh.
An offering of votes. How about we ask for an offering of votes? Everyone go vote. Vicki, one question is, if we've filled, is there any way to know, to ensure that if you think you filled out the census, that you actually did?
Oh, yeah.
Yeah, there is no way to check to see
Okay.
if you've already completed it. If you're still getting visits from census workers or mail asking you to respond, then there's obviously something about your original response that may have kicked it back to an enumerator. So we're just telling people to fill it out again.
Okay.
It'll be deduplicated anyway by the Census Bureau if they have a duplicate or multiple responses from the same address. They'll remove ones or they'll merge the data. So it doesn't really hurt anyone to fill it out again. And we're finding that many people who filled out the census without an ID, which is most of everyone that we're signing up, these responses keep getting kicked back to enumerators to follow up on. It may be that their response originally wasn't complete or whatever, but so chances are, if you're in doubt, fill it out again.
Great. Thank you both so much. So go vote, fill out your census. We need to be counted so that our neighborhoods can count. That's what I picked up. Go ahead, Jametta.
Quick question. Hester, you talked about having the data on 275,000 registered young people.
Yes.
Can many of us, 4824, Detroit Parent Network, Uni, others, we are rallying people. We've got parents on the ground to do this work. We want to rock this boat, in other words.
Yes.
Can we get that data that would show us where those registered young people are?
Yep.
Because we can be those touch points to say, hey, you got to be in this.
So let me tell you, you already know where they are. But I will give you some data that helps you to pinpoint. I talked about the 100 low performing precincts across the state of Michigan. 40 of those precincts are in the city of Detroit. We know exactly which census tract. We know exactly which neighborhoods. We know exactly which landmarks. We've been working through Detroit City Council district leaders to have conversations. 20 of those communities are in the city of Flint. The rest of them are in places like Ypsilanti, Ann Arbor, Battle Creek, Jackson, Benton Harbor, Sturgis, and Niles, Michigan. So I'll send you some data that I think will help you zoom right in.
Okay, wonderful. And so now, as much as we all want to keep talking about us grabbing our power, staying focused, we have to do something like actually end the program. So I'm going to sign out and I'm going to pass it to Christine to close us out. And special thanks to everyone that's been part of this. And let us remember our sister Breonna Taylor and stay focused to be powerful to keep this from occurring again, and let alone again and again. Thank you.
Thanks, Jametta. Thank you. And we want to thank all of our panelists. You brought such wonderful information, and that will help us remain as powerful as we can be in this moment, as well as informed. If your question wasn't answered, we'll get you the answers and post them next week on onedetroitpbs.org and on DPTV Facebook. To sign up for regular updates, you can fill out the form that's in the chat right now, or you can just put your email or phone number in the chat, or you can text us your email or phone number to 313-288-3673. 288-2082. Again, that number is 288-2082. We want to hear from you. We want to know what you want to hear about. So you can also use that number and the chat right now to tell us what experts you want to hear from or what topics you want us to cover during our program. We also have a few asks. The first is to please visit DetroitVotes2020.org and get registered. Get yourself to one of the early voting sites and or send in your absentee ballot. Please fill out your census. It determines how much money comes to our neighborhoods for the next 10 years. If you have an 8-year-old, that means until your child graduates from high school. It is so important. Fill out your census. Also, we have a candidate forum that we would love for you to attend this Saturday from 1 to 3 with the DPSCD school board candidates. It will be live streamed on DPN and 482 Forward's Facebook pages. We have 2 more asks. One is related to, we have this really great opportunity. If you find yourself at home and wanting to get involved with young people and ensuring that they count, there's an AmeriCorps program that we're looking for candidates for to serve as AmeriCorps members. That flyer is going in the chat right now, or you can call 313-841-4447 for more information. Our final ask is continue to say her name and show up to fight for Black lives every day. This town hall is truly a group effort. So before we go, we'd like all of our partners to turn on their videos. And we want to remind everyone to stay healthy, stay powerful, and stay strong. Cindy, can you say that in Spanish for us?
Manténganse saludables, manténganse fuertes y manténganse poderosos.
Thank you. Everybody have an awesome rest of your day and a good rest of your week.
Thank you.
Stay strong, be blessed.
All right.